So the one area that I absolutely used to love and now I have regretted and not loved is fillers around the eyes. I have found that, and you see it in celebrities, issues with migration. I think migration really doesn't occur very much when you're working on other areas like the temples, the outer cheeks, around the mouth. I really haven't seen that. In fact, I've seen really an incredible permanence of fillers in a good and a bad way. So fillers have a good and a bad, and I think one of those things that people talk about is, they talk about filler burnout, where fillers, you have to keep doing it to sustain it. I really don't see that. If I build it long enough, minus further aging, it really is quite sustainable. I've had patients do MRI studies even 10, 15 years after my fillers, and they're still there. I've migrated away from permanent fillers. You probably know I've actually had to cut out some of my patients with Bellafill injections. I think that's a problematic filler. Sometimes they show up as granulomas. I have to reverse it. One of my patients that had it done elsewhere responded to an excision, but then he had a little bit of recurrence, and he said that hyperbaric oxygen therapies worked for him. I thought that was a good pearl for you guys who are watching this video. If you have this issue, may want to try that first. In terms of getting back to the subject, hyaluronic acids such as Restylane, Juvederm, different types of brands around the eyes, I have noticed a problem of filling around the eyes, which is they look great for 1, 2, 3 years, and then they start to migrate somewhere at year 3 to 7. Even though these fillers are supposed to go away after a short time, they really don't. So I want to discourage people from doing fillers around the eyes. I used to love it, and so if you're one of my patients I've done it on, I'm sorry, I don't really like to do it anymore because I've seen these long-term migration issues. How does it show? So how it shows up is when you smile, there's a little ball that shows up underneath the eye. It's very hard to get rid of this in certain respects. If you try to dissolve it, you can over-dissolve it, under-dissolve it. What I try to do is if someone says, look, hey, I don't want fat grafting, which is my answer to really help hollowness around the eyes, and we'll talk about that briefly here too, is that the filler dissolve I do very conservatively if I'm not going to plan on a fat graft, where I use a dilute product using a cannula to minimize bruising, and I use an ultrasound guidance so that I can look for that filler and make sure I'm within the substance of the filler, and I'm gently dissolving it slowly over maybe 2 to 5 rounds. And that will help bring that filler down to the point where it looks good. Now you said, well, why are you so gentle with it? So the dissolve process of hyaluronidase that comes in different brands like Hyanex and Vitrace, etc. We use Hylenex, but I usually just use the colloquial term. I use Vitrace sometimes when I really mean Hylenex, but they're all recombinant hyaluronidase products. So it's just like saying Kleenex or Coke for me, or Botox when I may mean Xeomin, depending on the circumstance, because people know these brands. So I may call it to my staff Vitrace, but I'm using Hylenex. I don't think it really matters. But I'm using a dilute Hylenex or Vitrace product into the area, because what happens is that you can actually dissolve your own hyaluronic acid around it, because our collagen has a constituent element of hyaluronic acid. So that sounds scary, but it really isn't that much, because if you do dissolve your own tissues, they do come back. It does take several months, between 3 to 6 months. So if you aggressively over-dissolve it, it may take longer and it may be more profound, and people don't want to have that, so you want to be very careful. So if someone is going to have a fat graft, I'll be a little bit more aggressive on the dissolve so I can get it down as quickly as possible. I usually do that maybe 2 to 4 weeks. If it's really a lot of ball there, I may do it over 2 sessions, start maybe 4 to 6 weeks before. If it's a small amount, I may just hit them with a decent blast about 2 to 4 weeks before the procedure. Rarely do I have to go back and do it afterwards, but sometimes I do. So it just depends on what the plan is. Will I do fat or not, will I not do fat? So bottom line is I don't really do hyaluronic acid fillers around the eyes anymore for this reason. They look great, and over time there can be some migration issues. With fat grafting, I love fat grafting. You can watch my videos on fat grafting to really understand more about it. I don't want to go through a 25-minute video on fat grafting, but I want to talk about some of the salient points, especially if you're converting from a filler to a fat graft. It's a hard conversion, I'll be honest with you. It's not an easy. My favorite is when someone tells me they've never had fillers under the eyes, and then I can go straight to fat. If someone's had fillers under the eyes, even if they tell me it's 10 years ago, and if I see something there, the conversion is hard for 2 reasons. So the first reason is that it's hard to completely dissolve the product down perfectly. There may be still a little residual there, and someone needs to know that. I've had 2 patients converting from a filler to a fat graft that had a small cyst under the eye that persisted. I actually had to cut that little cyst out, and that's pretty rare. I mean, I do actually a decent number of filler to fat conversions, but I've had 2 of those, and the tiny incision healed great. It disappeared. But it's something you just need to know as a limitation of this procedure. And the final thing with fat grafting, and this is the big one, is that when people are used to the perfection of fillers, fat doesn't quite deliver that. And you can watch my 3 phases of fat grafting video to hear more about my philosophy, but fat is amazing. It just makes what I call right brain results that look good. With some of the limitations. Again, I'm not going to cover all that, but if you want to understand that limitation, especially if you're converting from a filler to fat, watch my video on 3 phases of fat grafting so you understand more about my philosophy to have the right expectations. So that's a quick summary of where I stand today on fillers around the eyes.